their health insurance. And they are scared to death about not being able to afford to go to a doctor for them, maybe for their kids right now. We're looking at people who are literally worried about not being able to feed their kids. Because if you don't have any income, you don't have any money in the bank, you're not going to be able to go out and buy the groceries that you need. And in West Virginia and all over this country, people by the millions are worried about being evicted from their apartments or losing their homes because they just don't have enough money to pay the rent or to pay their mortgages. That is the reality that we're in right now. And on top of that, of course, we have children not going to school, parents not knowing whether it's a good idea or not to send their kids to school, and on it goes. So what we are trying to do this evening, and we've done it just earlier today in Kentucky, and we'll do it around the country, is hear the stories, the real life stories of people who are struggling. And the demand that we have is that short term, right now, the United States Congress has got to respond to the pain and the fear that so many of our people are experiencing. What does that mean? It means is that I think most of you know, a number of months ago, Congress did the right thing. Didn't do everything I wanted by any means, but it passed legislation of over $3 trillion, which made sure that if you out there lost your job, in addition to your normal unemployment benefits, you would get $600 a week. That's no small thing. And on top of that, what Congress did is say, we're going to give you a one-time check of $1,200 per person and $500 for your children. And on top of that, we're going to prevent evictions. And we're going to provide substantial amounts of help to hospitals and to cities and to states and to help small businesses retain their employees, et cetera, et cetera. A lot in that bill. And that bill helped a lot of people during these very, very difficult times. And then what happened about 3.5 months ago, as I recall, the US House did the right thing, run by Democrats. But the House said, look, this pandemic is not getting any better. Workers are still hurting. They are still without jobs. They're still without income. And we've got to help them. And what the House did is pass something called the HEROES Bill, which continued that $600 check supplement that people were getting, which continued the $1,200 check per person, which helped small businesses, which provided health care for those people who lost their jobs, and massive amounts of money for cities and towns who today are struggling economically and who have laid off over 1 million workers in the last number of months. So I don't agree with everything that was in the House bill. I would have done things differently. But at least it was a very serious attempt to recognize the pain that people are experiencing in Vermont, in West Virginia, and all over this country. And then the House did what it did. You would have thought that the United States Senate would respond accordingly, or maybe say, well, we agree with you here, we disagree with you there. Let's talk about how we go forward. But the truth is that the Republican-led Senate did nothing. Week after week, month after month, everybody knew when the $600 supplement was going to end. They knew when the $1,200 were going to end. They knew when the help for the cities and the states was going to end. Healthcare was going to, everyone knew it. But the Senate did nothing. And finally, in the last few weeks, the Senate Majority Leader Mitch McConnell basically walked away from the negotiations with the House, and he left that to Treasury Secretary Mnuchin and Chief of Staff Mark Meadows. And they basically said, no, we are not going to continue the $600. We're not going to provide what the working people of this country need. And then Trump came up with some phony executive orders, which at best, I don't even know if they're going to be implemented, because you all know Trump, he says one thing, but doesn't really mean that it's truthful. At best, $300 a week for the next 5 weeks. I'm not sure because this is kind of a new program that the states will be able to even implement that. No money, no eviction prevention. People will still be able to be evicted. No money for nutrition. No money for one-time payments for families. No money for cities, for hospitals, for states. Basically, doing virtually nothing to help working people. And what we are trying to do around the country is to put pressure on Republican senators in West Virginia and elsewhere to say you cannot ignore the pain that is going on in your state, that what Trump did was nowhere near what has to be done, that we need to maintain that $600 supplement for unemployment. We need to get those $1,200 or more checks out to people, and that we have got to make sure that people in America are not going hungry. Now, on top of all of that, it's important to understand that not only do we have to respond short term, we have got to respond long term. And that is create a government, and I know Paula Jean understands this, create a government and a nation that represents all of the people and not just the wealthy and the 1%. And that means we have got to raise wages in America. I know in West Virginia, you got people who are working, for starvation wages where you can't make it on $8 or $9 an hour. And that's why we're going to raise that minimum wage to $15 an hour. It's why in America we have to join the rest of the industrialized world and guarantee health care to all people as a human right through Medicare for all. It means that we have to make public colleges and universities tuition free, that we've got to deal with the existential threat of climate change, that we have to create millions of jobs rebuilding our crumbling infrastructure because people need work right now. So short term, what we've got to do is demand that the Congress, and right now especially the Senate, do the right thing and stop ignoring the pain of so many workers who have lost their jobs and are struggling. Long term, we need to take on the wealthy and the powerful and create a government that works for all of us. So with that, I am delighted to introduce a young woman who is doing a wonderful, wonderful job in West Virginia in bringing working people together in the fight for justice. So please join me in welcoming Paula Jean Swearengin. Paula Jean, thanks so much.
Thank you, Senator Sanders. And I just want to take a minute and say thank you for being a true public servant. We have seen across the aisle that people don't stand up and fight for people. And you're a senator from Vermont, and you've been to West Virginia several times in the front lines of our communities, even when it was an election cycle, just because you cared. And we need more of that. And that's why I am running for the United States Senate. It's because of the plight of what my state is going through. I don't want to go too much in my story because we've got some important topics to talk about, but I want to talk a minute about myself and why I got to the place that I am. I am a poor coal miner's daughter and granddaughter. I've lived the boom and bust of the industry. My grandfather was in the coal mines for 45 years. He was a proud UMWA member, and he served in Korea. My dad served in Vietnam. He was a coal miner. He died of cancer at 52 years old because he was exposed to Agent Orange. And he had black lung. And that's been the fate of a lot of my family members. And I feel like I've been to more funerals than family reunions. And that's a reality for a lot of people in West Virginia. This is one of the sickest and poorest states in the nation. A lot of people in this state don't have adequate sewage systems. A lot of the people in this state don't have something as basic as a clean glass of water. Many of our communities, a lot of people live in impoverished conditions comparable to a third world country, and they have cardboard for windows. And we have seen an uprising in West Virginia, and we've seen an uprising nationwide, and that it contributes a lot to you, Senator Sanders, to create a movement and a government that's going to be for the people and by the people instead of corporations and lobbyists. We had 93 candidates in our primary that are ordinary people like myself here in West Virginia to swear off corporate and corporate PAC dollars and rise up and say that we're not going to take it anymore. 43 of those candidates got through their primaries. on a national level with people that I've been working with. We've just seen my colleague Cori Bush get through her primary, and she's going to Congress. It's amazing that we see ordinary people rise up. The reason that I decided to run for United States Senate again is the very reason is what's going on with this pandemic, is we need true representation in Congress. Thank you, Senator Sanders, for your good presidential run, but we know the work is not done, and you need allies in the Senate, and the people need allies in the Senate. It doesn't matter what your party affiliation is. At the end of the day, these people are supposed to be serving us and working for us, and every decision they make should be coming to us and not just special interest. And that's why I got in this battle again. And I'm really, really proud of my state right now. Every Democratic nominee for United States Senate is a woman. Every Democratic nominee for for the Congress is a woman. Every one of them are progressive, and every single one of them has sworn off corporate PAC dollars. Here in West Virginia, I think we're underestimated. We unite no matter what our party affiliation is, and women especially. And I think that our state has been abused so much that women are coming out kicking and screaming out of the belly of the beast and out of every part of the state where everybody feels like they're forgotten. And we have 4 women right now that are ready to bust the halls of Congress wide open and make sure that we have true people servants. And right now, with what's going on with this pandemic in our state, we have been proven to be one of the most vulnerable states in the nation because of this pandemic. Our governor decided to open up our state because of population, because our population is 1.8 million. We have a large elderly population in our state. We have a lot of sick people that are dealing with black lung, cardiovascular disease, cancer, asthma, diabetes. Just because the Industrial Revolution was built on the backs of West Virginians and industry left us breadcrumbs, and it's time for us to have a plan B. Coal mining is not coming back, whether you agree with it or not, and we need a just transition. And that's why I'm here, is to fight for economic diversity for my state. We are dealing with one of the largest addiction epidemics in the country. We lead in drug overdose right now, and we need long-term recovery systems, and we need people fighting for our communities. And most of our state is on Medicare, Medicaid already. So that's why I advocate for Medicare for all. A lot of our small businesses has closed during this pandemic, but they were closing their doors already because they were having a hard time surviving, and that ties into economic diversity. And if small businesses don't have to carry the burden of high premiums for their employees, they can put that money back into their business. But right now, what's happening in West Virginia is the same old narrative that we have heard from a lot of our incumbents. Let's just open up West Virginia. Those people don't have no teeth, no shoes, no brains, and we're treated like collateral damage. And it's time for that to end. And it's time right now, even when we're looking at what's going on with Congress, it's unacceptable that we don't take care of the most vulnerable in our society. And West Virginia is one of those states. When people turn on their light switch, this nation has been powered by the blood of Appalachians. And we should not be collateral damage during an international pandemic. And we can take care of our people. We can make sure in Congress that people have a healthy stimulus instead of trying to take unemployment benefits from hardworking people in the state that were already working 2 and 3 jobs already. Nobody sent the National Guard out to check on people in food deserts that don't have rural transportation and they have nothing but a Dollar General to go to. It's just unacceptable. And I stand with you, Senator Sanders, and I'm sitting on this panel right now to let Shelley Moore Capito know that's why this coal miner daughter is coming after her job, because she's a mother and grandmother. She was the first woman to be elected into the United States Senate to represent the state of West Virginia, and she has never represented us. And it's time that West Virginians grow for a change. We deserve to be treated like normal human beings. And like I said before, we are sick and tired of being collateral damage, and West Virginians are fighting back.
Paula Jean, thank you very much. And I look forward to working with you and to welcoming you into the United States Senate. Paula, are you or am I going to introduce our panelists?
Well, I've got the notes up about their biographies. If you want me to, I'll go ahead and introduce them. Our next, one of our panelists, which I'm really excited about this panel, we have oftentimes here in West Virginia, we are in the front lines of our communities. We are solving our problems while we're being ignored from the people that are supposed to represent us. And when I was approached about this panel, I'm really excited about these folks because these folks have been working really hard in the front lines of their communities. Um, the first is Rusty Williams. I'm sure you know him already,
Oh, I know
Senator.
Rusty, yeah. Yep.
He's a lifelong resident of Kanawha County. He's a cancer survivor, and he has turned into an advocate for Medicare for all patients' rights. He has proudly served as a patient advocate on the West Virginia Medical Cannabis Advisory Board since the inception in 2017, and it actually is currently a candidate for West Virginia House of Delegates in the 35th District. He has been involved in videos with you since 2018, and you also mentioned him in your book. But I want to say this one thing about Rusty too. His opponents in the primary raised around $50,000, and Rusty won his primary with around $5,200. And I want to thank Rusty personally for working so hard for our state and doing everything that he's done for us.
Thank you, Paula, for that introduction. That was awesome. Thank you, Senator Sanders, for facilitating this. And I feel, even though we are in a nightmare situation with COVID, I'm feeling hopeful. One of the things that both Senator Sanders and Paula Jean touched on, West Virginia, we're one of the most economically depressed states in the country, and West Virginians had it hard long before this pandemic showed up. And now that we're facing an unprecedented situation, we have patients and folks all across the state that I can't put into words exactly how much they are hurting. For example, I hear from patients all the time. From the time I got involved in fighting for patients and for fighting to end the prohibition of medical cannabis, patients, I feel like they reach out to me because maybe they think it's safer to talk to me than some of their lawmakers who have shown absolutely no interest in listening to them. And some of the stories that I'm hearing, they'll break your heart. One of my friends, actually, someone that I've known since I was a teenager, was diagnosed with colon cancer right at the beginning of this pandemic. And, he was forced to stop working because of the chemotherapy treatments. And now, he's having to fight unemployment. He filed at the beginning of April. He's going through chemo, and he has no resources at his disposal. To me, in the richest country in the history of the world, this is unacceptable. What we are doing to patients and to everyday working West Virginians and everyday working Americans, it's just unacceptable. And I look at it as a direct failure of our leadership. When the CARES Act was passed and the $1.25 billion was sent to West Virginia to help these struggling small businesses and to help patients get through this, to my knowledge, only 3% of those funds have been distributed so far. We've got folks who are struggling just to keep the lights on and to keep food on the table. And, our Republican governor wants to use those funds to fix the potholes. And to me, this is all, it's just a total lack of judgment, and it's showing us exactly how jacked up our priorities are. One thing about COVID, it has put a spotlight on all of the inadequacies of the status quo. And whether we're talking about healthcare being tethered to employment, whether we're talking about the fact that West Virginians are working for $8.75 an hour, this has shown exactly what we need to fix and the things that we need to do moving forward. I'm firm and I'm a huge supporter of Medicare for all. Nobody should ever have to beg for health care. No working person should ever have to wonder whether or not they're going to be able to afford to keep the lights on and to keep food on the table. So these problems, they have to be addressed both at the national and the state level. And Paula Jean touched on it here. I'm excited to say that all of our congressional candidates on the Democratic side, we've got Natalie Klein in the 1st district, we've got Kathy Kunkel in the 2nd, and Hillary Turner in the 3rd. They're all progressive. They all support Medicare for all. They all support raising the minimum wage. Paula Jean, of course, has been a champion of all of these issues her entire career in activism. So I'm encouraged and I'm hopeful that we can put the right people in office, but we're going to have to elect folks that have the right set of priorities. And if you're not prioritizing doing what is best for the people in your state that are hurting the most, then you don't deserve to hold public office in my eyes. So Again, thank you, Senator Sanders, for allowing me to participate on this panel. Thank you, Paula Jean, for facilitating this meeting. And, I'm happy to be here. I'll be happy to answer any questions that anyone has. And, as far as my run, this is exactly why I decided to run for office in the first place. After I experienced all of the nightmares with our for-profit healthcare system and basically had to beg for the coverage to save my life, I've seen exactly how bad this can be for folks. And I've dedicated my entire life to making sure that anyone that finds themselves in the position that I was in doesn't have to go through that nightmare. So thank you again for advocating for Medicare for all, and thank you for advocating for West Virginians, though you represent Vermont. That to me, that's huge. So
Thank you.
Thank you, Rusty. So if you want me to, do you have anything else to say, or do you want me to move on to James, Senator?
Why don't we move on, and then we'll take questions in a few minutes.
All right, so James has given me a long laundry list of credentials, so it's going to take me a minute, but he's someone that I deeply, deeply admire. He lives in the Eastern Panhandle, and he's doing a lot of great work there with addiction and a lot of other things. James is a Vietnam veteran, and thank you for your service, James. And he's a peer recovery support specialist with CCAR, credentialed extensive lived experience to addiction. He's actually been in recovery for over 9,000 days now. Congratulations, James. And he's also a Black Lives Matter activist. He works with GRACE, which is the Greater Resource and Community Empowerment Blue Ridge Resource Center. And he's also the board of directors for Habitat for Humanity in the Eastern Panhandle, the United Way in the Eastern Panhandle, and Spiritual Warriors Outreach Ministry. He's also a juvenile drug court mentor and also an adult drug court recovery coach, and he is the co-host of Talk Radio WRNR 107.5, The Red Hot Coach, and the host of a radio podcast called Recovery Enlightened Radio.org. It's I mispronounced that, ENLIGHTENRADIO.org if anybody ever wants to listen to his podcast.
Thank you for that, Paula. Enlightened Radio. So that's my 3 minutes right there. Right? I could talk about everything, but I'm going to try to spread it out and kind of talk like a radio DJ so I can get it all in. But first of all, I'd like to thank Paula for inviting me, and thank you so much, Senator Sanders, for always showing up with that heavy bag of truth that you must carry throughout your campaigns and advocacy. And the truth gets to be very heavy, and it's very lonely at the top sometimes. So I started shooting heroin into my veins at age 14 in Newark, New Jersey. And, I kept that up. I was in Newark, New Jersey, 6 or 7 riots. And then the Army showed up. And the Army came into my life at age 17. I spent a year in Fort Bliss, Texas, and where I was shipped off at age 18 to a place called Quan Loy, South Vietnam. And I spent the next 15 months there, where I just indulged in so much heroin and other drug activity, and also a lot of violence in my life as a Vietnam veteran. But I had a purpose when I was there. However, coming up against the racism and all the other activities that prevented me from, seeking a career in the military. Actually, it just discouraged me. And after 3 years of trials and tribulations in the military, I got out. By the age of 20, I was out of the Army, and by the age of 21, I was in prison in Virginia for heroin distribution, which was kind of exacerbated by my service to my country. But strangely enough, I found myself after looking back over my life, when I went to prison that first time, I was very comfortable because I had come out of a violent environment, as a soldier. But I'd like to add that I am a honorably discharged veteran. And I like to say that because I realize now that my career or my affiliation with all the substances brought me to this place for such a time as this, so that I can advocate for those who cannot advocate for themselves. And I was introduced when I moved to West Virginia as a veteran. I met Senator Unger, And I was telling him my story, and he said, James, you know the way out. And so you need to talk to other people. We need to get you credentialed, and you can, kind of advocate for these people. And so I started volunteering because, like I said, when I came from Vietnam, and I did heroin for almost 3 decades, and now my disease has been in remission for over 9,000 days. And I like to say it like that because then it gives me a lot of time and a lot of things to talk about with my recoveries and people and families who are seeking treatment. I have developed some very thick skin over the years and gotten a lot of insight after I got clean and sober. But while I was in that recidivism cycle, and while I was a commodity for private prison, and while I was a paycheck for a lot of parole and probation officers and court-appointed attorneys, when all the dust cleared and I'm still here, I realized that my station in life has a lot to do with my past. And I always say to my recoveries is that the backstory is the best story. Paula Jean, your backstory is the best story. That is the thing that made me gravitate towards your campaign. And I love the idea that the heroes act. I even like that word hero because I'm standing before you considering myself a hero, especially in light of all the opposition that I've come up against over these last, over 9,000 days. But I realized that the opposite of addiction is not total abstinence. The opposite of addiction is connections, connected to health care, connected to a quality of life, connected to your family, connected to community, connected to things like harm reduction. And I found out in West Virginia, it's so easy to get addicted to substances, opioids, and to stay that way because you become marketable.
Well, James, what I want to do now,
Yes, sir.
it's okay with Paula Jean. So I want to hear the next panelist, and I want to come back to you because obviously your experience with heroin is enormously important, given, as Paula Jean just mentioned, the terrible addiction that exists, problems that exist in West Virginia. So I want to come back to that, but let's take a break and move to the next panelist, if that's okay. All right.
Okay, so Senator, we're moving along to Casey Provence. She is the HOPWA Residential Resource Coordinator for West Virginia Covenant House. She's involved with a domestic violence support group called EVE, Ending Violence Through Education, facilitator for the YMCA. She works with domestic violent victims and their families. She also works in the housing population of the people diagnosed with HIV and AIDS in the southern 22 counties of West Virginia to end to prevent homelessness. She also works with and around substance abuse and treatment programs. She's worked in areas of social services since graduating from West Virginia State University with a bachelor's degree in criminal justice, social studies, and victimization. Thank you so much, Cassie, for coming in and giving us input on what's going on the ground out there.
Hello, I want to thank everybody for having me here. It's my first time ever doing anything like this, but I am extremely passionate about my jobs. Helping the type of people that I do is a little different than I guess talking politics all day. I literally every day, all day long, I'm with either someone who has HIV and AIDS, and I'm helping them, house them. I've handled about, since this pandemic, a little over 25 eviction notices that shouldn't have been handed out, that were handed out. Same thing with my DV group. Their biggest fear is being put out of their homes this is my support group that we have already put them in. We've already rehoused them, got them safe, got them jobs, and now they lost their jobs and they're on unemployment. And their unemployment has now, the $600 is gone. So now they can't afford in places that we just put them. And without any extra money coming in, I mean, yeah, we've got a little bit, but like Paula Jean said before, only 3% of that has even been distributed to our programs here in West Virginia. It's looking kind of rough for us to pull it all off. We don't want, there was the eviction stoppage. You couldn't write eviction notices. You couldn't go through with it. Well, they pulled that about the same time that they did the unemployment. Mm-hmm. So what they did is a lot of West Virginians stayed home because they were told to, and they didn't ask for help. And now instead of getting 1 month behind, now they're 3 months behind and coming to ask for help. Average rent is $550. 3 months is $1,500, $1,700 real easy. That's a lot of money coming from programs who haven't got their money yet, haven't got their stimulus package, haven't got their CARES Act package. There's even more things like with our DV victims. We have people, we have a shelter that I ran for 2 years, and now I just facilitate the classes because I run the HOPWA program. But we house 16 people. And these 16 people, if we get one kid that has a fever for 2 days, we have to put them in a hotel for 14 days. That's not cheap. We have one big fundraiser called Girls Night Out for this one shelter, and we can't do it because you can't go out. You can't have now. So now we changed it to online, and it's Girls Night In, and it's big, and we're still going to make some money of it. But that profit, that handles almost 20% of our actual money that we use to rehouse victims, to send them safely somewhere else, to change victims' names, to change victims' social security numbers so we can hide them from people. Like, this is affecting everyday people at all times. This isn't, I mean, yes, this 3-5 months that we've been in this pandemic, but it was longer than that. We needed money way before that. Now we just need 10 times more. DV has rose 20% since the stay-home order has raised because of stressors of money, because of being in each other's face, because of drugs. A lot of our DV is because of our opioid pandemic, and our DV goes hand in with the people who are going to programs. I can't get my victim into a program right now because there's barely any open. So I can't even get her started in her healing because there's no programs to get her feeling okay, that where she can actually be okay to do so. You know what I mean? We have waiting lists for almost every program because we don't have the funds to keep them all open. We have waiting lists for every DV shelter in West Virginia. We have 14 programs. There's not any openings. We don't have the money to put people other places ongoing, especially if we have to continue to keep these people safe and this vulnerable community so safe that we're quarantining these people for 14 days in hotels that are giving us discounted rates. They're doing what they can, but they have to stay afloat too. So it all just kind of comes together that the HEROES Act would completely push us, where we need to be. Well, let me take back completely. Will definitely be a good start to push us where we need to be and help, because right now the people who are struggling the most in real life without the pandemic are struggling 50 times more right now.
Well, let me just jump in and say, Cassie, thank you so much for what you have done and the work you're doing. I can't even begin to think how difficult it is and how stressful it is, and all of the problems and the tragedies you see every day. And let me thank James for his work with people who are dealing with addiction. What a terrible illness that is. And Rusty dealing with people who are struggling to find health care. So thank you all very much for being with us. What I would suggest now, Paula Jean, is maybe Misty, do we have anybody who would like to ask any questions?
Yep, we have a lot of questions, sir. Do you want me to jump into a few?
Yeah, why don't we, if that's okay with folks, let's do that.
Okay. This question comes from Ellen from Morgantown. With more people working from home, education being transitioned to online learning, and the increased use of telemedicine, what is the plan to increase access, affordable access to quality internet service?
Well, and that is a great question. And we didn't touch it here, but my guess would be that in West Virginia, as is the case in Vermont and all over this country, There are a lot of people, A, who don't have the kind of computers they need, and B, they don't have internet service because it is either inaccessible or it is much too expensive. So what some of us are fighting for is universal access and high quality broadband service, high quality and affordable cell phone service as well. And this is not only important for individuals and for students, it's important for the business community, because I don't know how you open a business in a town if you don't have a decent quality broadband or cell phone service. This is one of the issues, by the way, that we are trying to deal with in a new piece of legislation, which we are fighting to get done in the United States Senate, putting billions of dollars to expanding affordable broadband, quality broadband service all over the country.
Great. Let's just go to the next question. This is really relevant. So this comes from Stephen from Charleston, excuse me. What are our options as the USPS faces these challenging times? As an employee and a proud member of the community, it's hard feeling so helpless as the blatant dismantling occurs around me.
Well, I don't want to do the one answering all the questions. It was this kind of a congressional response. So let me just say a few words. Anybody else wants to jump in, please do. I am a strong proponent of the United States Postal Service. I've spent my life fighting against the privatization of the Postal Service because it's terribly important that regardless of what your income is, where you live, whether you're on Park Avenue in New York or some dirt road in West Virginia, that you get served and you get mail delivered to you every single day. What is going on right now, and what Donald Trump just told us the other day, very simply, he is trying to defund and, in my view, destroy the Postal Service because he does not want, this is what he said, he does not want people to be able to send in mail-in ballots. Doesn't want you to be able to vote by mail. And if you destroy the Postal Service, you're not going to be able to do that. I suspect that he thinks that if we can make it impossible for millions of people to vote and we have a lower voter turnout, he may be able to win the election. This is just so anti-democratic. It is so horrific. It's hard to believe that a president would be trying to do that, trying essentially to destroy the ability of people to participate in the political process. Telling people you got a choice. You could either go into a polling place and risk your health or maybe your life, or you don't vote at all. That is not what, James is a veteran. He served. Paula Jean's father and grandfather are veterans. People fought and died to protect American democracy, and that we have a president who's trying to undermine that democracy and destroy the post office is unbelievable. So what I would say to Stephen is we're doing everything that we can in every way to make sure that the Postal Service is adequately funded and that you and everybody else in this country can vote by mail if that's what you choose to do.
I'd like to add something to the end of that, if I may, Senator.
Yes.
Yes, I'd just like to say to the gentleman that asked the question is just vote. Get everybody in your building to vote and get everybody on your block to vote no to Donald Trump.
I concur with that 100%. Okay, Misty, we have another question.
Sure. This question comes from Jesse from Gilbert, West Virginia. The question is, what is your plan to end the opioid epidemic that is killing people in our area?
Well, you know what I'm going to do with that one? I have some thoughts on it, but I'm not the expert here. We have somebody who is dealing with addiction, maybe more than one person. So why don't we give it over to James? James, why don't you briefly give us some ideas what the United States Congress can do to address the opioid epidemic in West Virginia and, in fact, in many other states around the country?
We can do one thing very simple and very quickly. We can make a seat at the table for those people who have struggled and survived addiction and find out what it is that those people did and then enact those things that help people to seek long-term recovery, get in long-term recovery, and stay there. After rehab, then what? There needs to be a complete overhaul of the system, the way that the care is delivered. Because right now, everybody who continues to be addicted to substances, opioids, illegal drugs, they become a commodity for prisons. So if we can get that message, I think the education of the country around opioid addiction, and to, bring us to the table. Nothing
Good.
about us without us.
Very important point. Paula Jean, did you or Cassie or Rusty or anybody else want to add to what James said?
Yeah, I do, Senator. This is actually a very important topic to me. I don't know West Virginia that's not been impacted by addiction. So I've spent a lot of time with folks like James and other people on the front lines of our communities to figure out how to solve this problem. And one of the biggest issues is, of course, we had a lot of opioid shipped into a lot of small communities, and that should have never happened. And there's some preventative measures that are preventing from that happening right now. But also, we have to get rid of the stigma of addiction first. I know 80-year-old women that trusted their medical providers and went in for hip surgery, and they came out addicts because they trusted their medical provider. But the thing that we need the most is long-term recovery systems. Drug replacement therapy plays a vital role, and it seems like because of a lot of our incumbents are funded by big pharma, their vision is only tunneled back into drug replacement therapy. And I've heard from a lot of people that are in recovery, they do not want to take one drug and replace it with another drug. Long-term recovery systems work, but they need support on a state level and a federal level for funding. They need support of social workers. They need support of medical providers. And that's also ties into Medicare for All. During this pandemic right now, we already led in drug overdose deaths in the country. Those numbers have increased since this pandemic because people have been waiting to get into long-term recovery centers, and they're not available. They need to be on every corner where people are dealing with this pandemic. And right now, we're dealing with several crises here. We're dealing with water crisis. We are dealing with the addiction, as well as this pandemic and poverty and all those things. But also, too, we have to make sure that people have a true path to be in productive parts of society. A lot of addicts have faced criminal charges, and if they can't even get a job in fast food and being part of their recovery when they get out and being part of the vital parts of society once they get out, and that's part of the recovery system, then we fail. And like James said, give people a seat at the table. I think so many West Virginians feel like they're not heard, and there's people like James and all kinds of leaders across the state are trying to really hard to implement long-term recovery systems, and the funding is just not there for it.
Okay, great. Thank you very much, Paul Jean. Misty, we got more?
Sure. The next one that I'm going to pick is from Mason. Mason asks, what are the first steps in transitioning to renewable energy without hurting the coal miners of West Virginia? Mason comes from Morgantown, West Virginia.
Paula Jean, you want to take a shot at that one?
Yeah, actually I do. Right now, there is no just transition. We had over 140,000 coal miners in the 1970s, and we have less than 50,000 nationwide. And one of the biggest and cruelest lies that a politician can tell is coal's going to rebound, because it's not. And we have not had anybody that's a lot of our incumbents that are not visionaries for our future. It's been proven that renewables are viable here. We have hotspots for geothermal. This is the birthplace of rivers. We could use our dams for hydropower. We could grow hemp on mountaintop removal sites. If we legalize cannabis, we would see economic growth within 6 to 8 months. If we had comprehensive broadband, good roads, good schools, and infrastructure, we would invite business here. But there is no just transition. Coal miners are starving. and they deserve to have good jobs, as well as our educators, our nurses, our teachers, our doctors, our state employees. Everyone deserves a good job. But right now, we don't have a plan B here in West Virginia. And that's one of the reasons that I run for office, is because people are dying and starving, and we can't put our eggs in one basket anymore. That can't happen for us. We've seen what it has done to our state, and a lot of our people are having to leave our state and find work elsewhere, especially a lot of our children. And a lot of people just want to come back home. It seems like we come 48th and 49th and 50th an opportunity, but we never get there because people are not there for us. They're for corporations and lobbyists, and they've not taken care of our communities and our state.
Okay, thank you. Misty?
Next question is from Matthew, also from Morgantown. A recent study released showed that nearly 60% of West Virginia renters are at risk for eviction, making us one of the highest risk states in America. What is being done to protect those renters, and what can we do here in the state to protect them as well?
Well, as I mentioned earlier, Matthew, the U.S. House, well over 3 months ago, passed what they call the HEROES Act, which not only would prevent evictions, maintain the moratorium on evictions, but would help people be able to pay their rent. And that is precisely what we're trying to do in the Senate. What we're trying to do now is to say, sorry, you can't throw people out of their apartments or their homes. But in addition to that, because people are unemployed, they don't have the money, we're trying to help people be able to pay their rent. So it's a two-pronged approach. But as Matthew tells us, this is a enormously serious problem all across this country. People should not be thrown out of their homes. I mean, it is just unspeakable. So we have got to demand again that the U.S. Senate act right now in protecting working people.
Rusty, do you have any thoughts on that?
Yeah, he's 100% spot on. Senator Sanders was spot on there. I would like to, if it's okay, touch on one of the questions that you guys just answered, and pertaining to our addiction epidemic here in West Virginia. I'm a firm believer that all of this, when we're talking about addiction, it goes back to the economics. I feel like the root cause of addiction for most people is trauma, and that trauma could come from living in poverty. There's multiple different ways that people can experience trauma. But I feel like our elected representatives, especially here in West Virginia, when it comes to looking at the issue of addiction, their first inclination is to jump towards punitive measures. And Mr. Boyd hit the nail squarely on the head when he said that the opposite of addiction is not sobriety. The opposite of addiction is connection. And when we punish addicts and treat them like criminals rather than patients, the way we should look at them, we're furthering the disconnect. And I feel like the way that we are approaching solving this problem, we're actually making it worse. So, to me, we have got to start treating people suffering through addiction like human beings, rather than, we can't throw away people just because we're mad at them, and I feel like, and until we shift the way we look at this issue, nothing is going to get better. We need to be looking into harm reduction initiatives, and that could be, long-term recovery, of course, that is needle exchanges, safe injection sites, things of that nature. We do know, we've got the data that shows that states that allow patients to access whole plant medical cannabis see a reduction of 25% in opioid-related deaths and overdoses the first year of implementation. So there's multiple avenues we can take to address addiction, but these punitive measures of just locking people up and calling them criminals because they are suffering through addiction is only making things worse.
Let me jump in and ask Misty, I'm going to ask a question, if that's all right. Mm-hmm. For a number of years, quite unbelievably, the United States of America has actually seen a decline in life expectancy. changed a little bit, I think, in the last year. But for a number of years, people in America, despite improvements in medicine and prescription drugs, etc., people were living shorter lives. And states like West Virginia, Kentucky, have been part of that decline in life expectancy. And what the doctors say is that the reason for this decline is what they call diseases of despair. Diseases of despair, meaning people are turning to alcohol, people are turning to drugs, and in some cases, even suicide. I think, Rusty, you touched on, but what is going on that people are turning to drugs, to alcohol, to even suicide? What is going on in people's lives that result in those decisions? Who wants to jump in on that one?
I
Rusty?
mean,
I'll take this. Great, I'm sorry.
I feel like when people are struggling to keep the lights on, when your entire life, you're doing everything you can, you're working every day as hard as you can just to maintain the very basics of human needs. It's natural reaction to reach out to anything that makes you feel better. For some people, that's a bottle of alcohol. For some people, it's cannabis. For some people, it's prescription drugs. For some people, it's gambling. Some people, it's food. Addiction, when we talk about addiction in West Virginia, I think it's we're doing ourselves a disservice when we only talk about the opioid epidemic, because we've led the country when it comes to tobacco use, when it comes to binge drinking and alcohol abuse. West Virginians have been suffering for a long time. And it still goes back to the economics for me. Even when, we're a coal producing state, that's what we're known for. But even when our coal production, when metallurgical coal production was at peak value, West Virginia citizens still teetered between 47th and 49th economically. So all of the natural resources that are literally right under our feet, they get extracted by these out-of-state companies, and the profit goes right out of state with them. And I'm a firm believer that until we address that, until we start electing folks who are willing to prioritize people over the bottom line profit margins of these out-of-state corporations, we're never going to address the addiction epidemic here. And in fact, every year when we cut taxes for coal companies and we cut taxes for natural gas companies, we're in fact making our addiction problem worse. And you hit the nail on the head with diseases of despair. And in West Virginia, poverty is that despair. Poverty is traumatic. It's not easy to live in poverty. And unfortunately, West Virginia, we have a state full of people who are suffering every day.
And also it's environmental, Senator. And also because we've broken our workers, that coal mining is one of the hardest professions in America to go and deep in a coal mine. It's been proven it's one of the hardest professions that you could have. And a lot of our coal miners were sent to the local clinics, and they got addicted because they were broken. And we see all across the state, it's not only in coal mining communities through my travels, even out in communities like Weirton, where they had Weirton Steel. Those people feel forgotten. They live in impoverished conditions comparable to people in the coal fields. And it's all over the state. It's not just Dow County that lives in, that leads impoverished conditions. We have people all over the state that are living in horrible, horrible conditions. And it's even in the rural areas, it's not even comparable to in the cities. If you go into these rural areas, that's what they live in, but in a city, they would tear it down. And that's just the thing. And people are so disconnected, I think. I've heard from so many people across the state that they feel so oppressed. They feel so unheard. Out in the Eastern Panhandle and the Northern Panhandle, they're 4 and 5 hours away from our capital. And it's even hard to reach the people that are supposed to represent them there, and also in Washington, D.C. And you were one of the senators came here and actually sit down with me as a coal miner's daughter. But for us to be heard, oftentimes we have to get arrested for even for our incumbents to hear us. And so that's the big problem. There's a disconnect. It's not, there's no war between us. It's a war between us and their so-called representatives. Like I said before, we've been treated like collateral damage. How many times can you cry and say, I'm suffering, before you either fight back or you give up? And so many people in this state feel so oppressed and so downtrodden because they don't have anything. People say, if you don't like it, move. How can they move when they don't know where their next meal's going to come
All
I'd like to
right.
add something too to that, Bernie.
Yes,
It's
please.
generational here. So when I say generational, we have people who live, and I'll just talk about Charleston because that's where I'm at. That's where I'm stationed just right now. But we have people who live in, let's say, Section 8 housing, and they grew up in Section 8 housing. Well, they know that if they don't make so much money, if they don't do this, and if they know that hell right here in Section 8 housing. You know what I mean? And I'm thankful that we have that and we do, but they get used to that. So they don't try. There's a lot of people who get used to seeing like their or my children alone. They see me working 3 and 4 jobs at a time, and I work with the people. I work, in social services. I was a CPS worker. I still had to have 2 jobs, 3 jobs. I was running the domestic shelter in Charleston, the only one in Kanawha County. I still had to wait tables. I mean, there's and it's nothing about my employers. My employers are great. There's nothing about that. It's just they just don't have the money to do it. There's nothing else to do. I see that happen way more than it should. Instead of a kid moving out from with their parents, they take over at 18, they're Section 8, and their parents move to a disability place instead, and now they're just handed off onto Section 8, and they'll get comfortable like that. We have to start teaching. We have to show them that there is more, and we have to teach them that there is more. We have to start at the children, or we're never going to get anywhere. And they see they see the drugs, they see the abuse, they see the people struggling for food, they see people with this. We have a food pantry that right now we have 27% more people coming to our food pantry, but people got all these food stamps and all this stuff that was supposed to be extra. People, because they don't know how to budget it, don't know how to do the things that they're supposed to do because they're not taught, and they weren't taught from their parents, and they weren't taught from their parents. Somebody has to step in. A social worker at school would be great, if we could get that funded to have the one social worker at 3 or 4 schools would be wonderful, but we don't have that right now.
And there's such an undue burden on our educators right now, especially with talking about opening up our schools because of the addiction and the poverty and everything else that's going on with their state. Our educators have not only acted as educators, but they've also fed our children and acted as counselors and parents to the children that they're trying to teach in their classrooms because it's so hard here. And now we're talking about opening up our schools in the middle of a pandemic when we're not allowed to congregate no more than 25 people in a public park. And that's just the thing. It's just like the people in the Appalachian region, we're not victims, but we seem to be forgotten. We're not victims because we stand up and we take care of each other. And we've always, if we're hungry, we feed each other. If somebody's in trouble, one of us are in trouble, all of us are in trouble, despite what our partisan politics are. But when it comes to a government that serves us, we feel forgotten and we feel underserved, especially after we've sacrificed so much to power this country. And that's why we're fighting back, is because we are tired of it being underserved. And we just want a government that will serve us and take care of us and treat us with the dignity and respect that we deserve as proud Appalachians.
Well, maybe on that note, Misty, I think we can thank Paula Jean for helping to organize this and for running a great campaign. And we need people like Paula Jean in the Senate who come from the working class, who have not forgotten where they come from and are prepared to fight for workers. And I want to thank all the panelists, James and Rusty and Cassie, for not only for being with us, but for the great work that they're doing every day. It's not easy. All of you are engaged in really tough stuff. So with that, let me thank again Paula Jean, and thank all of you for who are viewing the live stream, and look forward to being with you again in the not too distant future. Take care, everybody.
Thank you, Senator.